We're talking to Ms. Consuela Green, and of course the topic is making changes for life. And she's given us some information relative to how people might be able to extend, in a real sense, their lives by some of the changes that they might be able to make in terms of their diet and their lifestyle and et cetera. Of course, Ms. Green, let's continue that discussion.
As we were speaking during the break, I wanted to just throw this statistic out there. Recently, Nashville was noted as the heaviest city in the nation. Forbes magazine actually did a survey over 50 cities of which city was the heaviest. And Nashville rated as the heaviest city. 68% of the population were considered obese or overweight.
68% of the population in the city of Nashville.
In the city of Nashville. And that, I can give you some more statistics, because when you look at the Metro Public Health Department Behavior Risk Factor Surveillance Survey, their statistics gives us numbers for Davidson County. So we have about 49% of Caucasians who are considered or classified as overweight, and we have about 67% of African Americans that are classified as being overweight. That says something.
It says a lot.
That
says a lot of health
something.
things.
And the truth is that the statistics wouldn't be there if it wasn't true. And that means that there are some things that we have to do. What are they? One, this center, which is free of charge, actually offers benefits to those individuals who are suffering with overweight, being overweight, or with chronic illnesses that can be managed, or for individuals who want to smoke, want to change their eating habits, or if they just want to prevent disease. And it's so sad, but we need to look at preventing disease, doing something before it happens. Not just knowing it, but when you find out and being made aware of it, that you begin to apply and make those changes beforehand so that you can live a longer lifestyle and a longer life. We often say people want to live because of their grandchildren or because of their, spouses. But what about this time being a little selfish and living because of you? You can do it for everyone else, but if you don't do it because of you, it won't work. And that means I have to change my mindset. If you're going to change your behavior, you got to change your mindset. You got to break down some of those old patterns of thinking and ways that you used to do that were harmful to you. So if you know that there's a celebration coming up and you know how your family cooks, or whatever, you may want to be the one to encourage, you know what, Aunt so-and-so has high blood pressure. Or, by the way, I was just diagnosed with high cholesterol, and we need to make some changes. We don't need everyone, this doesn't need to be a generational curse, but we need to pass down generational blessings. And so what this means is that I have to stop and start with me, so that my children and where my children live, that they won't be getting to an age where they see me debilitating or being in a wheelchair because of something that I can do something about. And so that leads to our unhealthy behaviors, leads to complications that we could have prevented, like the kidney dialysis and, like the cancer,
and the
amputations and the blindness and, the strokes, all of those things. We can prevent those if we just take concern and take care of ourselves.
Do you think it's a matter of trying to get more information to the community in reference to these things? Or what do you think that people have been saturated with information and they know the problems, but they still? Well, I mean, what?
I think it's a combination of things. I think it's not just there are a number of people who do know about some of the chronic illnesses like diabetes, but there are also a number of individuals who do not know. There are a lot of myths out there that need to be just taken away, because a lot of times people say things that they really don't know anything about, and they can be speaking just ignorantly. And so we want to make sure that we have the truth first of all, but then second of all, there are a lot of people who are in denial. A lot of people who are experiencing symptoms even now, that's even listening to this television show, but because I'm afraid, or because I really don't want to know, and because I think that I got to die of something anyway, I just won't even go get myself checked out. But remember that 20% is based on genetics, 50% is behavior, and that means that behavior means I need to get up from where I am and I need to begin to do something. And then the other thing is some people just don't have the access that they need, the access to care, going to the doctor. But again, people don't have the money. But again, this program is free, so there is no cost. There's no cost for anything that you need. We're going to provide that for you. You just have to take the initiative to call us, 341-4899.
And you're picking up $500 almost for each patient for the kind of testing, et cetera, which is to say that if they were to go to their own personal physician, that they might be thinking in terms of paying that kind of money. And your benefit is as great as the physician.
Yeah, absolutely. We're not in competition with the physicians, but we're working hand in hand with them. So that means if there are physicians that are even listening to us, they can refer them to us.
Okay.
We will love that, because all we do is whatever we do with them, we're going to definitely provide that feedback back to the provider, so that provider will always know what it is that we're doing with their patient. We're not a medical care facility.